It's actually a pretty straightforward user interface, but by the time you're going to want to know it pretty well by the time you get in the scenario. So at first we want you to sit back and relax and watch us use all these little widgets in the user interface, and then we're going to let you try it, and then we're actually going to have a training game where you can get used to the interface before we get into a serious scenario. So Arnold is going to show you some various things. Why don't we start by showing your face, Arnold? Why don't you turn around?
There's the views list. I click face.
Okay, so you'll notice the interface basically has a lot of buttons around the screen that you'll want to press, and the typical mouse and cursor. Arnold is represented by this character here. He just pushed a button to wave. And then you can also just look at your own face if you really want to admire yourself. And Arnold, if you can smile or do some kind of, maybe the sad expression, you could show that you can. And so when he starts to talk, his lips will move. So there's a little bit of lip syncing. And this is part of how
I'm talking over my headset now.
Yes. So this is part of how we interact in this environment. Everybody's represented by a character, and the character acts in a human-like way as you control it. So the way this world works is when you're talking, just standing there talking, everybody around you physically, the other characters that are in the room, they can hear you. Characters far away cannot hear you. So you need to use the radio to talk to people that are far away, just like you do in the real world. And so for your specific character, the first few letters in this list will indicate which character it is. For example, female MD number A, and you will have a choice of scrubs, PPE, or PPE with a PEPR protective device. So you need to choose a position that you're going to stand in, and so Arnold's choosing one there. And once you take a position at the bed, you're going to have some controls that you didn't have before. These are popping up so that you can now do examinations, diagnosis, and treatment of the patient. And also you can pop up the bedside monitor using this action tag. These patients are actually being acted out for you today by real live human beings who are logged in from actually all over the United States. So they're human beings, they can answer questions. Let's examine the face. That doesn't do magic. So with each one of these motions that actually would involve interacting with the patient, you will see, so here's the picture of the face of this particular patient. Again, it's not visualized in 3D, so we're giving you the picture, information in a picture, and also text. And you can use that. Okay,